Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diagnostic criteria for polycystic ovarian syndrome. There is Rotterdam criteria. According to Rotterdam criteria, any two of the following should be there for the diagnosis of polycystic ovarian syndrome. 1. Hyperandrogenism. Hyperandrogenism clinically manifests as hirsutism. In hyperandrogenism, there is biologically increased androgen levels are seen. Ovulatory dysfunction. Second, ovulatory dysfunction. Ovulatory dysfunction includes amenorrhea, irregular cycles, and menometrorrhagia. Third, third includes ultrasound evidence of polycystic ovarian disease. Ultrasonography evidence of polycystic ovarian disease is seen either in one or both the ovaries. Here, ultrasound shows more than or equal to 12 follicles in the ovary, and the follicles should be less than 1 centimeter, that is 2 to 9 millimeters in size, and the volume than or equal to 10 cc.
It should be there should be 2 to 9 millimeter sized follicles. There should be more than 12 follicles, each being 2 to 9 millimeters, and the volume should be more than 10 cc.
Obesity is not a diagnostic criteria. Luteinizing, LDH to HDL ratio, LDL to HDL ratio is not a diagnostic criteria. Polycystic ovarian disease can be seen in a thin patients. Polycystic ovarian disease is most common in reproductive age group, but it can also be seen in prepubertal age group also.
thank you and thank you for watching.